With summer slowly winding down, we enter an uncertain autumn when it comes to COVID and boosters.
Pfizer and the Food and Drug Administration this week to authorize an updated version of the COVID booster designed to target the BA.5 Omicron subvariant.
So are boosters and more vaccines in our future? And what about monkeypox? Lots as usual to talk about with UW Health Chief Quality Officer Dr. Jeff Pothof. Thanks for being with us.
Hey guys, how are you?
Hi.
COVID is still a threat, even though it's not making headlines these days. We're talking about other stuff, but it's still there.
Yeah, I think, much different than talking to you guys a year and a half ago, where there was, an uncomfortable number of people getting really sick and dying from COVID. That number is certainly lower, but we still have COVID, and I'm surprised by how many people say, hey, I got COVID, and like, boy, that was a rough week.
Yeah.
It can still make life a little difficult.
Vaccinated people, fully vaccinated and boosted people.
Even vaccinated people, that mild to moderate encompasses, a pretty awful week. It just doesn't include so bad that you're in the hospital.
Well, the BA.5 variant is still our big focus. So how is that going to impact us heading into this fall when it comes to, hopefully not repeating last fall?
Yeah, I think it's possible that we could see some cases go up as colleges and schools start. We're just going to see a lot of people gathered together. We could see more cases. I'm not sure that that means more severe disease. We have a good bit of immunity in the community. CDC says up to 95% of people have some exposure to COVID, either through vaccine or infection. And we have these hybrid vaccines that are coming out that may actually target the most common variant that we're still seeing, which is BA.5. So cases might be up, but I'm not sure that that's going to also result in an increased hospitalization.
So we can expect probably a booster this fall.
Yeah, I think it's pretty likely we will see the FDA approve one of these or both of these bivalent vaccines from Pfizer, Moderna, and then with that, they'll give guidance on who's eligible. Certainly, I think those who are older, who've typically been at higher risk, are going to be eligible right away. But I also think those of us who have been boosted once but not a second time, basically everyone under the age of 50, are likely going to be eligible for this bivalent vaccine sometime this fall.
Is there any concern that, switching gears to monkeypox now, is there any concern that as colleges are back in session, will that affect the spread or the dangers of it?
I think there's a theoretical risk there. So monkeypox, the way we're seeing this outbreak spread is really close skin-to-skin contact, and that probably does happen with some increased frequency with individuals who are, say, in college. But, we don't have that crystal ball. I'm not sure that'll materialize into enough additional cases where it makes this take off more, or whether that'll be something that we'll be able to manage kind of within the current construct with, vaccines and things like that.
There is a vaccine for it.
Yeah, there is a vaccine. There's actually two. The old smallpox one would theoretically work for it. We have another vaccine. That's the one that you're seeing used most often, and typically reserved right now for individuals who have had like an exposure or they have monkeypox. You'd be eligible for a vaccine, or for individuals in high-risk groups, they may also be eligible for a vaccine.
And we all got smallpox shots when we were young. Well, scars to prove it.
Not all of us, but yeah, those of us.
My generation.
Yeah, right.
So
Thank you.
Would that cover this?
Yeah, so it might. The thing that we don't know is we haven't tested your vaccine out. There hasn't been smallpox. You haven't been infected. So theoretically, people who are vaccinated against smallpox may have enough immunity to prevent monkeypox, but we don't really have the study that says yay or nay to that.
And it's not fatal, but it's very painful from what I understand.
Yeah, in this current outbreak, especially in the United States with our medical system, smallpox hasn't been shown to be overly fatal in this population, but it can be a pretty rough course and it can last a long time. It's uncomfortable. So certainly not something that I would, go out and get. It's not like when kids had chickenpox parties. We don't want none of that. But not nearly the same risk as, say, COVID-19, not even on the same game.
Yeah, and then so on the college level, going to schools, elementary schools, high schools, when it comes to just having contact with these, what should parents remember to keep their kids safe?
Yeah, I think, for COVID-19, that's still the bigger threat compared to monkeypox. If you haven't gotten your school-age kid vaccinated, it's a good chance to do that. They're probably going to get exposed. Give them that protection so they don't get either too sick or have those long hauler symptoms. For monkeypox, I think transmission in school is going to be less likely. It can spread via air, but not very well, not like COVID, and it takes that prolonged skin-to-skin contact. So if you're worried about your kids, playing most sports or things like that, I just don't think you're going to see a lot of transmission in that environment.
And go ahead.
Oh, I was going to say that's a big key. Then it's not as spreadable, transmissible as COVID.
It's much harder to catch than COVID. This is not a repeat of COVID.
It's not a respiratory droplets. They
think you can, but it's certainly not the predominant mode of transmission versus COVID. That is like the mode of transmission. But monkeypox, what we're seeing is close skin-to-skin contacts. Not just like brief, like seconds, but a little bit of contact there.
All right, fingers crossed for the fall.
You bet.
All right, Jeff. See you next week. Thank you.